Hello and welcome to Birth and Baby Talk. This week we're talking a little bit about gestational diabetes. I'm going to go give you an overview of some of what's going on with gestational diabetes and offer some tips for best managing it if you have it, or trying to prevent it if you don't yet have it. And so let's dive right in, shall we? So gestational diabetes is the same almost as regular diabetes. It has more or it's closer to type 2 diabetes in the sense that your blood sugars are processed more and more slowly throughout pregnancy. Therefore, you have more and more blood glucose running through your system. And part of that kind of makes sense from an evolutionary standpoint that, the bigger the baby becomes during pregnancy, the more energy they need, right? The more literal calories they need coming in to help to sustain their and increasing growth and the maintenance of those tiny little bodies. So it makes sense that your body would sort of slow down production of the sugars that are in your system naturally. But when we get into gestational diabetes, we either have a situation where your body is unable to properly process the sugars, and so there's just too much of them, or you are putting too many sugars into your body and overwhelming your body's natural ability to manage those sugars. So that can lead to a number of complications for people who do end up having gestational diabetes. For the birthing parent, it could mean that you have a higher risk of high blood pressure and preeclampsia, as well as an increased risk of having a cesarean birth. And it can lead to a higher prevalence of having diabetes, type 2 diabetes, after pregnancy, either immediately or in the longer term, right? Your body is sort of primed to develop type 2 diabetes if you have gestational diabetes. For babies, they also have that factor that their bodies are sort of chemically primed to have a greater chance of diabetes in the future. But they also have the risk of having very high birth weight, like very high birth weight. We're not talking like a chubby 8-pound baby or 8.5-pound baby. We're talking like a 10-pound plus baby. And when we have babies that are that chunky, we also sometimes have babies whose it's not just fat, it's kind of like big heads, big shoulders, because the idea is that those babies have been getting so much excess energy in the form of sugars in their nutritional feed coming from their parent, that their whole body just grows, like super grows, just because it has so much extra fuel to be able to grow larger. So we have these larger babies, and those larger babies then pose a problem sometimes for delivery. Now, some chubby babies come out with no difficulty. And I've had clients who had surprisingly large babies. At least one of those babies was like historically large for the hospital they were born at. However, that also leads to some problems for a lot of those babies, in that it may be more difficult to give birth to them. So a big baby will squish, but they also might take longer to sort of move through their parent's body to be born, which means they're spending longer in labor, which gives their bodies more stress, which increases the chances of having more interventions given to them and more risks. One of those risks, unfortunately, is stillbirth. And that is a real serious risk, which is why we take this whole thing of gestational diabetes very, very seriously. But other risk factors are that the baby's head and shoulders are quite big. And when that happens, sometimes those shoulders can get stuck as the baby is trying to come out. So, you might be pushing your baby and the head is born, but then the shoulders, it's difficult to release the shoulders. And so the baby kind of gets stuck in there, which leads to a lot of intense squeezing on the baby's chest, which can be very dangerous for babies as they're being born. Additionally, the efforts to help give birth to those babies who are stuck, we call that shoulder dystocia. When the shoulder gets stuck, it usually gets like hooked on the pubic bone and is unable to sort of come down. And one of the problems that can happen with that is nerve damage or a broken collarbone. Or other stresses to the baby's body in our effort to help pull them out while the parent pushes. So those are some big deal problems that are potential, but other things such as preterm birth. So a baby who comes prematurely in, sort of like after 32 weeks, but before 37 weeks, in that zone, the chances increase. And that those babies, when they're born, also often have low blood sugar, which means it's really, really important to get a lot of food into them, right? When babies are born, they're sort of set up to be able to go with a smaller amount of food initially as they learn how to nurse. But if they come out with low blood sugar, then it's really imperative to make sure they get a larger amount of food into them so that those sugars can get balanced out in the bloodstream. And low blood sugars can also negatively impact babies' health and their overall health for all of their body systems and organs, right? So these are legitimate concerns. Let's back up though to see, like, does this apply to everyone? Is everyone affected? And let me see if I forgot to make a note about this. How many people are affected? Let's see. I'm not finding that number. This is not good. I should have made a note of this, and I don't have that information. I'm not going to speculate, but a factor of a decent amount of people being affected by gestational diabetes, plus the risk factors that we just talked about for those who do have gestational diabetes, warrants that we test everybody, right? So gestational diabetes has the potential to affect every single pregnancy given certain circumstances. And some of the circumstances that increase your risk level are being overweight during a pregnancy. So a lady like myself will have an increased risk over my counterpart who might be slimmer. Someone who is sedentary, someone who is not doing a lot of exercise, who is not active in their everyday life, is also at an increased risk of gestational diabetes in pregnancy. PCOS, so polycystic ovarian syndrome, also raises your risk. And of course, when we get into PCOS, we're starting to look at conditions in the body that mess around with the hormones and how they interplay inside the body. So the PCOS is partially a metabolic issue and a hormonal issue. And so we start to see that kind of overlapping with diabetes, which is also like a metabolic issue, a hormone issue. If there's diabetes in your family, or you are pre-diabetic. So if you have, say, parents who have diabetes or grandparents who have had diabetes, your chance of developing gestational diabetes in pregnancy rises a little bit. If you are pre-diabetic, you have a very strong predisposition for developing gestational diabetes. If you had gestational diabetes in a previous pregnancy, but now, between pregnancies you were fine, you have a very strong risk of developing gestational diabetes. And if you are Black, Indigenous, or another person of color, of Asian or Hispanic descent, Latin descent, those people face a higher risk of developing gestational diabetes. So when we have people with those pre-existing factors, then your healthcare provider is going to pay a little more attention and be very insistent on getting gestational diabetes testing. And it is offered to everyone across the board, much like doing an ultrasound to check for fetal development, or doing blood testing to check for if there are any sort of structural issues with baby, if there are any deformities that can be seen. Those kinds of tests are offered to everyone, the same with gestational diabetes. And the testing for gestational diabetes is something that's called the glucose challenge test. And a glucose challenge test is, you come in the morning after a short fast, you drink a whole bunch of super sugary liquid. Usually it is like this, almost like a Tang orangey, sugary orangey drink, kind of gross. You drink it, and then after about 20 minutes, you have a blood draw and your sugar levels are looked at. If you do not have gestational diabetes, then there is a predictable pattern at which those sugars that you just ingested get processed. If you do have gestational diabetes, or you have near gestational diabetes, then again, there's going to be some predictable numbers that the lab will be looking for to determine whether or not your body is having trouble processing those sugars. So if you do have gestational diabetes, it's not the end of the world. It doesn't mean you have to go on insulin. You will be given a number of options. And those options can depend on how severe the issue is. So if you do have gestational diabetes and your body is really struggling to process the sugars it is ingesting. And when I say sugars, I don't mean that you're sitting in front of a sugar bowl eating spoonfuls of sugar. I mean, your morning avocado toast. The toast has a lot of carbs. There's some carbs in the avocado. There's carbohydrates, which switch into sugars, glucose, in the bloodstream as they're processed inside the body. So when I say sugars, I'm really just talking about glucose levels within the body. And I don't mean like table syrup is your favorite drink. So depending on the way your body is processing those sugars, that glucose, in how quickly it can pass and flush them from your system, or like use them up and then flush the excess, how well your body does that will determine what options you get. And you may get, the simplest option would be for just maintenance through lifestyle choices, which would include food choices and activity choices, or on the very far end of things would be introducing insulin injections. And, there are a number of factors sort of in between there. So if you have a higher chance of having like severe gestational diabetes, then it's really important to listen to your healthcare provider's recommendations for medication, because that's not, because the risk factors are so high for baby, we don't want to mess around with that, right? We also do want, of course, to take, like if you have a borderline gestational diabetes or very, very sort of mild, we also want to make sure that we're paying attention to our healthcare providers' recommendations and taking those seriously, because it's very easy to manage your sugars if you do introduce a few factors. So some of those factors are, I've made a list. So eating a diet that is high in whole foods, also in whole grains. So, reducing some of those really highly processed simple sugars in the form of, like white breads and things like that. So introducing some more higher fiber foods, foods that are lower on the glycemic index, so that your body doesn't end up with a lot of excess carbohydrates and glucose in its system. And then the companion to that is about 20 minutes after you eat, go for a walk. Walking about 20 minutes after every meal you have is an incredibly efficient and simple way of using up any excess sugars from your meal that maybe your body is struggling a little bit to process. That's one of the absolute best ways of managing those. And when you do that, of course, you will just raise your health levels overall. And you want to also consider, if you're not yet pregnant, you can consider reducing any excess weight or some of your excess weight and making some lifestyle changes before becoming pregnant. So to therefore reduce your overall relative risk of developing gestational diabetes. Yeah. Have you had gestational diabetes? Leave a comment for us. Let's open up a discussion. If you have had gestational diabetes, how severe was it for you? Did you see any negative kind of impacts on your birth itself? Did your doctor decide scheduling a C-section was a safer way to deliver your baby? Did your baby grow larger than they might have otherwise? Or did you develop any conditions during pregnancy that elevated your relative risk level? And how did you try to manage your gestational diabetes? Was it well controlled through dietarian and activity choices, or did you have to introduce medication to manage things? I'd be very curious to hear other people's experiences during their pregnancies. As with everything, every week we try to bring you important information that you can use during your pregnancy and your postpartum recovery, your early parenting experiences, your birth, to make them better, to make them, to give you information so that you feel more informed, to be able to give you information you can use to improve your experience of pregnancy, birth, and parenting. Thank you for joining us. Come back next week when we will be here Wednesday at noon. Sorry, we're a day late because I had a baby arrive yesterday. Not me personally, one of my clients. And so I was away supporting them. That could happen again, of course, in the future. But we always want you to come join us Wednesdays at noon. That's when our shows are scheduled. And they're available on Facebook and on our YouTube channel. We have lots of incredible videos. So please come and check those out. We'd love to have you. Bye for now, folks.